Okay, so I thought it might be really fun if, like, you've seen my videos, right?
Yeah.
You know I have costumes.
Yes.
Let's imagine you come to London and then you have a pain or some problem that you really need a doctor for. What do you do? How do you describe things? What might your doctor say? And how do you understand everything? And like that, we're in your doctor's surgery.
Studio magic. This is my doctor's surgery. It's very similar to the set we were chatting on.
It's so similar, but it's not. So one thing I love that you do on your channel is like you'll watch an episode of House and you kind of try and diagnose the patient, but you explain it in such an easy way.
Oh, thanks.
So I thought maybe we could practice something like that. I'll have a symptom.
Cool.
And maybe you can diagnose me.
Sure, let's do it.
Let's do it.
In this scenario as well, if you're struggling with English, we always have options to get interpreters as well. You know, in hospital, we can often get another member of staff who can sit in, who may be able to speak the language, or we can get people on the phone. So that's always an option we can use.
So that's an option then?
Absolutely.
You could have an interpreter.
Exactly.
Perfect. But you should try. Why not?
So first of all, whenever we talk to a patient, the first thing we want to explore is ask you about what's brought you in. So tell me about what's been going on. Tell me about what's brought you in today.
Okay, well, for 2 days, I've been having cramps. So notice, grammatically, I said, I've been having cramps. I used present perfect because it's from a past time until now. I've been having cramps.
Okay, so with all symptoms, that's something that a medical thing that's going on, that's what we call a symptom, the doctor would want to explore that symptom in more detail.
Okay.
So with this particular one, I'd ask you, where do you have the pain?
It feels like it's in the bottom of my stomach, in the lower part of my stomach.
Okay. So the stomach, we actually think of being quite high up, but actually people think the stomach means the whole of the abdomen, the whole of the tummy as well, but we can use it interchangeably. So that's why it's important for us. It doesn't matter if you use these layman's terms. We have to identify that and find out. So I may say, can you show me where you're having the pain? So you could get me to point out.
I told you I was stupid. But no, that's really interesting. So in English, we say my stomach or my belly. Just this whole area is my stomach or my belly, right? Okay, cool. So
I know where the pain is now.
Right.
And you've given me a bit of a hint that's been going on for 2 days. So with this, I'd want to know what I'd call the FIDO. So I want to know its frequency. So I'd ask you, how often do you have the pain?
It's about every hour, and it lasts about 10 minutes.
Okay, good. So within that as well, you've also given me the duration. So that's the D in FIDO. So you give me the frequency, so how often you get it, and you've given me the duration. So when you get it, how long it lasts for. So the I is for the intensity. So I'd like you to give me a score.
Right.
How, at worst, how bad is the pain?
Okay, so in general, it's about a 5, but last night it was so bad that I fainted. To faint means you lose consciousness, you fall over, or another phrasal verb, to pass out. So I could say, last night the pain was so bad I passed out.
Okay, so I want to explore those symptoms of what led you to pass out, but we'll leave that for the moment. So the O stands for the onset. So tell me about what happened when it first came on.
Okay, so for about a week it's been hurting a little bit, but progressively over time it has been getting worse.
Okay, fine. So with this particular symptom, I'd want to ask a few more questions. We actually use a slightly different framework, but this isn't a medical thing. We normally use Socrates, so a few more mnemonics to explore. But one of the things in Socrates is, does the pain radiate anywhere? So radiate means, does it move from one place to another? So you said the pain's here. So does the pain go anywhere else?
Yes, it's moved to the side now.
Okay. Fine. And have you had any changes in your urine or any changes opening your bowels?
Nope, they are beautiful.
Very good. So, I mean, we'll kind of end that particular roleplay thing there, right? Because we kind of I'd worry about something like an appendicitis. So you're a young person with abdominal pain that started centrally and has now radiated to the side now. And that's what we'd worry about in that circumstance. You'd also have other symptoms, so feel generally unwell, fevers, but because the pain made you pass out, that's the type of thing we'd be looking at.
Okay, what happens next? Like, what questions would I expect? What would you ask me?
So then I'd want to know about any medical conditions you have, so your past medical history.
How does that question go?
So I'd say anything that you see your doctor regularly about, or any medical conditions you have.
We'll say no.
Cool. And then I'd ask any previous operations you've had.
Okay. I had my tonsils removed a few years ago. Mm-hmm. Is that relevant?
It is relevant because although it may not be relevant to this body system, we know that you may have had certain medications, certain anaesthetic drugs that we know you're probably comfortable having again.
Okay.
So then after we've done the kind of looked at your past medical history and past surgical history, I'd talk about any medications that you're on. So I'd ask you any drugs that you take regularly.
So this is an interesting thing. So you said drugs. Now, if your doctor asks you about what drugs you take, probably you don't mean heroin.
That would still be important to tell your doctor. But when we talk about drugs, we're not talking about illicit drugs, so drugs you smoke or drugs you inject. We're talking about medications you take to treat medical conditions.
Right. So do I take medications? We don't say I eat a pill or I eat medicine. We'd say I take the medicine. Or if it's maybe long term, I could say I'm on the medicine name. So, I don't know. Last month I was on antibiotics for an infection.
Fine. And then when I'm exploring your medications, I'd want to know about any allergies, any drug allergies.
Okay, perfect. Now, if I have an allergy, I use this structure. I'm allergic to name of thing. So this is true. I'm allergic to penicillin.
Okay.
I've just told everyone how to kill me.
That's all right. We won't be giving you that. You shouldn't be giving him that.
You could also say, I have an allergy to penicillin, or I have a penicillin allergy.
So the last thing we talk about in the history, after we've done the drug history, we talk about your family history. So ask you if you have any medical conditions that run in your family.
Nope. We're a healthy bunch.
Good. And then we'd ask about your social history. So I'd basically keep it very open. So I'd say, what job do you do?
I'm a teacher.
Okay. And I say, have you had any foreign travel recently?
I went on holiday to Italy.
Okay. But nowhere sort of outside of that in the last few months?
No.
Cool. And then I'd ask, do you smoke cigarettes?
No.
Have you ever smoked cigarettes?
No.
Okay. And do you drink alcohol?
Yes.
So then I'd ask you what you typically drink in a week.
Maybe I have 1 or 2 beers a week.
Okay. So 1 or 2 pints of beers.
Yeah.
Okay, fine. So there's about 3 units in a beer. So I'd say you have about 6 units of alcohol a week. So that may be relevant, but in those quantities, it wouldn't be relevant.
Cool.
Okay, and the last thing we should be talking about is any concerns you have. So how are you feeling? Is there any particular worries you have? Because very often people know it's not just they come with illness, they have preconceived ideas and worries about why they're coming to the doctor. So
right.
There should always be an opportunity. So I'd say, is there anything worrying you that's brought you in today?
Yeah, I've probably got cancer. That's always my worry. If anything hurts, I'm dying. I've got cancer.
Absolutely.
And I'll Google it.
You're so right. Google often doesn't help these things because
No.
cancer can have lots of symptoms, but a doctor will be able to take a look at the whole picture and be able to reassure you.
Okay, so I don't have cancer?
With the given symptoms here, it would be very low down on my list.
Okay, good. That's put my mind at ease.
So then after we've done our history, we'd then do an examination of you. So in this instance with the abdominal pain, we'd probably want to take some observations. So check your blood pressure, check your heart rate, measure your temperature, and a few other things. I'd also want to have a feel of your tummy or your belly, as we said earlier. And then from there, organise some investigations, like blood tests and possibly a scan.
You as a patient, you might say, I'm going to have a blood test, or what would you say as a doctor? How would you tell me that?
So we can say, I'm going to take a blood test, or take some of your blood, or take a blood sample. It's very much a take action because you're giving us something.
Right, you're not borrowing it. You
Not
don't give
usually.
It back. And finally, might I need surgery?
Okay, well, with this particular condition
Yeah.
that we're thinking about, absolutely. I mean, this would be an emergency. So if you were presented to your family doctor, we'd want to refer you into the hospital for these blood tests and for the scan, because we can do that very quickly. We can't do them in a GP practice straight away. And then from there, you would certainly be under the surgical team to rule out the possibility of needing surgery.
Okay, but if I do need surgery, the way I can say it is I'm going to have surgery
Or have an operation.
or have an operation. See, now you're an English teacher.
That's it.
Boom. So let's get out of your practice. Let's get out of your surgery.
Cool.
And we're back in the studio. I asked you guys to send me your questions about medicine in the UK. Any medical questions that you might have, we'll answer them for you. So let's have a look.